Have you ever heard of neuropathy? If you suffer from it, you know all too well how painful it can be. It can cause burning, tingling, pain, even numbness in your arms, your legs, and your feet. But what can you do about it? Dr. Tim Kelly with Kelly Chiropractic says that there is a way to reverse the pain or the condition. And Dr. Kelly, welcome to our show.
Thank you.
Now, you're in Richmond Hill. You've been there for quite a few years.
24 years.
So in all those years, have you seen a lot of patients with neuropathy, and what kind of pain are you seeing with this condition in your patients?
We've seen quite a number of neuropathy patients. We've kind of figured out it's kind of an epidemic.
I hear more and more people saying they're suffering from neuropathy. What exactly is it? Describe the symptoms for our viewers who may be feeling the same way and they don't even know that they have it.
Neuropathy is essentially not getting enough blood flow to the tissues. Therefore, the tissues and the nerve are dying. Mm-hmm. It can present with anything from numbness, tingling, pain, burning.
Does it come on all of a sudden, or is it build up over time?
It's a slow over time.
Okay.
Some of the symptoms may change back and forth and that sort of thing, and all the symptoms are basically the nerve screaming while they're dying.
Wow.
So it can lead to amputations and a lot of other issues in the long run. It was something that was considered untreatable, mm-hmm. other than through gabapentin, Neurontin, all the different sides of that, but none of those really treat to fix.
They don't stop the problem. They just treat the symptoms.
They basically dumb it down until it gets worse.
And if you don't do anything about it, I mean, you mentioned amputation, or with the numbness, I'm sure that can lead to falls, right? Which can lead to more serious problems.
Throws balance off and
mm-hmm.
everything else, so yeah.
All right, so what can you do? What are you offering at your office?
We have a neuropathy reversal program. We have a lot of very specialized equipment. We have a number of different ways of going about it, but all in all, we're looking to restore blood flow. Once we get that blood flow back and stimulate the tissue, then the tissue starts to grow.
So what kind of results are you seeing in your patients then?
We've seen, I think, as high as probably ballpark of 90%. Sensory loss come down to in the 20s.
Oh, that's huge.
So, and used to with our program, it would take a year to a year and a half to get the maximum amount of reversal, and that's what most programs that deal with neuropathy do. What we have achieved with a lot of our specialized equipment is we're getting this down to the point where it's about 3 months.
I came to Dr. Kelly with major problems. In 2001, I had a large fall from waterfall in Blowing Rock, North Carolina, and been through 35 surgeries from back to legs to elbow, and my feet continued to get worse, and that's why I came to Dr. Kelly. And he offered this 3-month program, and it started working pretty immediately. He didn't make big promises like you're going to be pain-free. I knew that wasn't going to happen, but he said I can help you, and that's what he's done. I'm able to not dance, but I've been able to live life as I should be able to with a lot less problems.
Any side effects from this that people need to know about?
Not really. In the initial portion of it, they may feel a little more discomfort as the nerves are coming back up until the other fibers take over to actually block pain.
Okay, so that's actually a good sign then.
Oh yeah.
All right.
Very. It means it's coming back to life.
All right, so for our viewers who would like to connect with you, what's the easiest way to do that?
Just call our office. It's 912-756-8080.
All right, thank you, Dr. Kelly.
Thank you.